Welcome to the RVU OMM Mechanisms of Action series. This edition will look at the proposed mechanism of action of osteopathic cranial manipulative medicine. It is important to understand some concepts before discussing the proposed mechanism. The foundational concept is the primary respiratory mechanism. It is primary because it is first in importance and primary in maintenance of life. Respiratory refers to the exchange of gases and other metabolites at the cellular level. Mechanism implies an integrated machine with each part working together as a unit to carry out this fundamental physiology. The primary respiratory mechanism is associated with 5 phenomena. Let's look at each of those now. The first is the inherent motility of the brain and spinal cord. The inherent motion of the central nervous system is subtle, slow, pulse wave-like movement and is biphasic, specifically named flexion and extension. The second is fluctuation of the cerebral spinal fluid. The combined activity of the central nervous system and cerebral spinal fluid functions both as a pump and as a bioelectric generator. The third is mobility of the intracranial and intraspinal membranes. The outer layer of dura mater forms a periosteo covering for the cranial bones, internally and externally. It then extends down the spinal canal with firm attachment at the level of the second sacral segment. The dura responds to inherent motion of the CNS and fluctuation of CSF and movement through the biphasic cycle, influencing the bones of the cranium and the sacrum. This functional anatomic unit is called the reciprocal tension membrane. The fourth is articular mobility of the cranial bones. The sutures between cranial bones allow for a minimal amount of motion while still providing protection for the brain. The fifth is involuntary mobility of the sacrum between the ilia, interdependent with the motion of the sphenobasilar synchondrosis. The sacrum responds to the inherent mobility of the CNS, the fluctuation of CSF, and the pull of the intracranial and intraspinal membranes, with an involuntary movement. Somatic dysfunction within osteopathic cranial manipulative medicine can be articular, dural, or fluid. So now back to the proposed mechanism of action. The reciprocal tension membrane is used to balance the tension within the system. The balance point is the most neutral position possible to reduce the tensions to an absolute minimum. Methods for arriving at the balance point may include indirect action, direct action, disengagement, or opposite physiologic motion. This positioning allows the primary respiratory mechanism to move through the involved tissues at maximum efficiency. This leads to resolution of the somatic dysfunction, whether it be articular, dural, or fluid. All right, so now you know how osteopathic cranial manipulative medicine works. And remember, as A.T. Still says, an osteopath reasons from his or her knowledge of anatomy and physiology. This has been an episode of the RVU OMM Mechanisms of Action series.